Now to some exciting new research that's being done right here in Chicago, treating a debilitating disease that really targets women, mainly women of childbearing age. Lupus is an autoimmune disease and in which the body mysteriously turns on itself. And doctors at Northwestern Memorial Hospital have been making amazing breakthroughs treating the most serious symptoms of lupus when all else seems to fail.
Deep breath. Okay. Very good, very clear.
That's good news for 46-year-old mom Kathy Hammonds, who battled lupus for 20 years.
Kathy had very severe lupus, and probably the worst part of it was the involvement of her lungs, so she was on oxygen. She'd been on oxygen for 2 years before coming to us.
At the time, I really believed I was going to die.
7 years ago, fatigued and overweight from side effects of steroids used to control her lupus, Kathy sought the help of Northwestern Memorial Hospital researcher Dr. Richard Burt, who was then pioneering the use of a patient's own stem cells to treat extremely severe cases of lupus.
I would say before this option, they hit a brick wall. They had nothing more, no further treatments except continuing failed therapy.
Once the stem cells are collected and stored, patients undergo a tough 2-month treatment.
We bring the patient in and we give them chemotherapy to destroy their immune system. And then right after the chemotherapy, we infuse the stem cells to make a brand new immune system.
An immune system that will no longer attack the patient's body. Since the stem cell transplant, Kathy's lupus has been in remission for 7.5 years. She's no longer on oxygen and no longer on steroids, helping her lose over 120 pounds.
Yeah, I passed you and you didn't know who I was.
Yes. I never use the word cure. I say it's promising. You know, I think if we use the word cure, God will humble me.
Dr. Burt's initial stem cell transplant study was conducted on 50 lupus patients, and after 5 years, half are still disease-free. His study now offers insight and hope for the more than 50 million people suffering from other autoimmune diseases, like rheumatoid arthritis and multiple sclerosis.
A little over a year ago, Bethany Papalardo could not walk around the block. She was diagnosed with multiple sclerosis when she was just 18 years old.
The most frustrating part to me was that I was my freshman year of college. I was away from home, and I had to learn how to give myself injections.
Like most MS sufferers, Bethany's symptoms manifested at any time.
I woke up one morning and my legs were numb. By the end of that day, I was numb from the neck down.
Frustrated with the not knowing, last year Bethany contacted Dr. Burt, whose stem cell transplant treatment was also showing promise for people with early stage MS.
If you get them earlier, where there's a lot of inflammation and they're not getting better no matter what, they get better.
I thought maybe this can be different, maybe this can go away, maybe it can be a typical 25-year-old woman.
Bethany underwent the stem cell transplant and says for her the worst part was losing her hair.
Since the procedure, she's had not only no more attacks, but she's had marked improvements and she's functioning normally.
And despite the uncertainty of remission, Bethany, like Kathy, would do it all again.
However long this lasts, until my dying day, I would never renege on anything that I've gone through.
The thing I enjoy most is just being a mom again. It's the best.
2 grateful women who, for now, have a new lease on life.
And this could be the first effective new treatment for lupus in nearly 40 years.